Okay. Thank you, Peter.
That's the shortest time we've ever heard Peter talk in 10 years.
It worked every minute. Okay, our next speaker is Dr. Howard Flume. Howard is a practicing chiropractor here in Chiang Mai, and he's going to give us a little overview of chiropractic care and how it relates to the other medicines and can work with some of the other types of medicine available too. Dr. Flume.
Is this one still on? Hi. So I wanted to cover a couple different things. We'll start with what is chiropractic. I think that many people in the West have an idea of what chiropractic is, or more an idea of what chiropractic is for, rather than what chiropractic is. That here, especially in Thailand and in Southeast Asia, it's not a common type of care. So people here seem to not really know anything about what chiropractic is. They see some videos on YouTube or on Facebook, some of which frightened me, that they then extrapolate, I don't know how, seeing somebody brutalized on film and say, well, I'll go do that. That sounds like fun. In any case, chiropractic, the simple answer is it's healthcare. You have a problem, you go to some form of doctor. You could also go to a chiropractor for practically all of the things you would go to for a medical doctor. Heart attack, no. Cancer, no. Broken bones, no. Bleeding that needs to be stitched up, no. But practically everything else. So chiropractic differs from medical care, Western medical care, in the paradigm of what it is, why we do what we do, how it is that we diagnose, and how we treat. Medical care is called allopathic, and allopathic starts with the idea that whatever it is that gets you from this level of good health to not such good health, they need to do something to you to make you get better, because if they didn't fix you, you wouldn't get better by yourself. And that's why they use medicines when they're necessary. That's why they use surgery when it's really necessary. And then chiropractic and practically every other form of healthcare that you can think of is called holistic. And holistic starts with the idea that whatever it is that got you from here to here, you would get better all by yourself if you could, okay? And if you can't, then there's some sort of obstacle in the way. And then it's my job as a chiropractor, as a holistic care provider, to find what that obstacle is and to try to remove it so that you can get better by yourself. What we do is a lot more teamwork oriented with patients than when you go to the medical doctor with a white coat on the big pedestal in the hospital and they do everything and then send you off. So I work with patients. Let's see, what else can we tell you about chiropractic? Chiropractic works primarily with the spine, and the reason why we work primarily with the spine is your brain is what controls everything in your body, okay? It gets its message to all the different parts of the body through your spinal cord and through the spinal nerves that come out at every level. That system runs through your spine. And if the spine is not working properly, then those nerves can't work properly. If you were to look at a nerve function on an oscilloscope, like an EEG or an EKG, you see all those blips and waves. If you aggravate a nerve somehow, it's going to increase the amplitude of the electricity in that nerve. So instead of this much, it's going to be this much. And that's not right. So whatever that nerve message is that's going to the different parts of your body is not going to be correct. There are lots of other differences. There's frequency, how many of those blips you see go across the screen in a given time frame. That changes also when you aggravate a nerve. If you aggravate a nerve long enough, it starts to die off. So instead of increased amplitude, you end up with decreased. And that's not going to work properly either, so you're going to lose your health. So as a chiropractor, we work with the spine. We're looking for something called subluxations. Subluxations are bones that are not positioned as perfectly as they could be, and it's not dramatic. It's not like this. It's a millimeter. It's a degree or two. And then once the bone is not positioned as well as it could be, it has the possibility of being stuck in one or more or all of the planes of motion. Once it's able to be stuck, then it's able to put pressure on the nervous system. Sometimes, not every time, but sometimes. And that pressure is almost never bone on nerve or disc on nerve. It's an inferred pressure. It's an aggravation that causes a swelling, and that swelling puts pressure on the nerve. And once you put pressure on the nerve, you're aggravated, and now the nerve doesn't work right. So your brain gets its message to every part of the body through the spinal cord, and all different parts of the body are telling the brain what's going on in the body through that same system. So your heart is telling your brain what your blood pressure is at the moment, how your pulse rate is at the moment. And so that if you get scared by something and need to run down the street, the brain knows how much do I need to increase the blood pressure, how much more fast do I need to make the pulse to be able to support the system to do what you want to do. If you look at the nerves in the brain and in the spine, you have two major distinctions. One is motor and one is sensory. Sensory is all the different information coming in from the different parts of your body, including the senses, sight, smell, touch, taste, hearing. But more than that, information from the different organs. Motor is the doing part of your nervous system. It causes motion. It causes your organs to do what they do. It's the action. So if you look at the motor part of the nervous system, that's broken down again into voluntary and involuntary. Voluntary is, I want to move my arm, okay? Involuntary is, my heart needs to beat at a certain pulse rate at the moment to do what it is that I'm doing. And I can't really control that. You have some control over relaxing or being upset, and that will increase your heart rate and increase your blood pressure and so on and so forth. But you don't have any direct control over that, so it's involuntary. If you look at that involuntary system, it's broken down again into parasympathetic and sympathetic. The sympathetic speeds up everything in your body except for digestion, and the parasympathetic speeds up or slows down everything in your body except for digestion, which it speeds up. That's the reason why your mother told you don't go swimming after you eat. Your energy is working on digesting your food, and therefore you won't have the energy for your muscles if you get stuck out in the water. So the different parts, sympathetic and parasympathetic, are located in different areas of your spine. And as a chiropractor, I know where they are. And if you come to me and you tell me that I have Crohn's disease, or I have ulcerative colitis, or I have diabetes, or I have hypertension, I know where the sympathetic portion of the spine is that sends nerves to those different organs is, and I know where the parasympathetic area is that sends information to those different organs. And then it's a matter of listening to your history and deciding what it is that's really wrong that's causing your problem, and then deciding, do we look more sympathetic or do we look more parasympathetic? Chiropractic is considered what's called a science, an art, and a philosophy. The philosophy we all get in school, the science we all get in school, but the art is something that takes time to figure out how to develop. There's finesse in doing what it is that you do to move bones in the spine and elsewhere. We can move bones at any joint in the entire body, including the skull. The skull has joints, believe it or not, and sometimes they're responsible for causing headaches. There's a reason why every single thing happens in your body, and it can be diagnosed. Sometimes we're limited by technology. There isn't a test, or there isn't a good test, or there isn't a test that's available here in this city to figure out what it is that's wrong with you at the moment. Or more likely, the doctor just isn't quite smart enough, and we're not able to think past this problem. I think that's extremely common. I think that the lay community tends to think that medical care and health care is a science, an exact science, and the doctor should be able to figure out what's wrong with me, and why can't they do this, and why can't they do that? And the fact is, it's not really exact. And then you're dealing with a doctor who is a human being, who is not perfect, who is not all-knowing, and we have limitations, and we do the best that we can do. And chiropractors and medical doctors who don't have huge egos and can't figure out what it is that's wrong with their patients refer out to other kinds of doctors that might have a better idea. Unfortunately, that doesn't happen as much as it should. So I also wanted to talk about the other forms of holistic healthcare. You have massage, you have acupuncture, you have pretty much everything that isn't Western medicine and dentistry. Those are really the two allopathic types of care. And then there's osteopathy, which skirts the line between holistic and allopathic. A lot of what they do is allopathic, but they also mobilize the spine. So it's similar in ways to what we do. Acupuncture I have a working knowledge of, but no, I'm not an expert in it, and I don't know how to explain it completely, except for that there's energy in your body, and it needs to be moved around in a particular way, and that there's heat in your body, and it needs to be hot in some areas and cold in other areas. And there's water in your body that needs to move around in certain ways. And acupuncture helps to move those different things around your body, where they need to be, when they need to be. So it increases the possibility of your being healthy. Chiropractic I know a whole lot about. Actually, on Thursday was my 33-year graduation anniversary. So I've been doing this a little while. I think I'm pretty good at what I do. I guess I'm not the judge of that, my patients are. I wanted to show you a couple of the things that I use in my office that help me to diagnose what it is that's wrong with patients. This is going to be kind of small, and I'm not sure that everybody will be able to see it, but on the recording, you'll be able to zoom in on it and see what's going on. This one's in there. This here is called a nervoscope, and turned it on. My hands are freezing cold, so it's not going to help. I'm going to use my arm. It measures the temperature difference from one side of the spine to the other side of the spine. Directly, it's a temperature measurement, but indirectly, this thing has a battery inside, so it's measuring conductivity as well, and several other things that are more esoteric and harder to explain, but I understand what it is that I'm looking for with the scope. I run that down somebody's spine, and it shows me where the nervous system is having problems. So instead of some of what you might have seen on Facebook or on YouTube, where a chiropractor or somebody who is moving spinal bones who is not a chiropractor racks and cracks everything in the body. Within the profession, we have a joke and we call it HEFO, hit every effing one of them. And it's not good for you. It's not dangerous, but it's not good for you, and it doesn't fix anything, and it doesn't accomplish anything. So you would go in with whatever it is that's bothering you, come out feeling better almost all the time, and then have the exact same problem all over again. It's like bringing your car to the mechanic and you need to have a new battery, so he cleans up the terminals and puts them back on the battery and says, okay, it's working now, and then next week you have the exact same problem again. What we do as chiropractors, those of us who use a technique, are fixing the problem so it goes away and you don't have that same problem again. You might have some other problem in the future, but you don't have the problem you came in to meet with. If I can't see what I'm doing with the nervous scope, I have this other scope here. This is at least as old as I am, 59 years old, so it looks ancient. Can you help me out with something here? Hold on to this with your hand. No. So, hang on. Actually, hold this for you. So you can hear that, I hope. Here.
Something all the way down?
No, I'm just showing the connection. Can you hear that?
Yeah.
Okay, so I can use this to zero in on a much smaller spot than I can with the scope. So the reason why I'm good at what I do is because the treatment is ultra specific. I can find exactly where your nervous system is having the problem, find the bone that's causing that problem.
I'm sorry, what is that second instrument name?
You know, I don't really know.
Oh, it's magnetic
No, it has batteries inside, so it's using conductivity. It's not measuring temperature from one side to the other. It's measuring mostly conductivity and, again, a whole bunch of esoteric things that I could explain, probably not as well as I could to a lay audience, as I could to a chiropractic audience, so it's kind of useless for me to try to explain it. But it helps me to be as specific as I can possibly be. I almost never need to use this. The first scope gives me practically all the information I need, and then I examine the spine to see what is stuck, why is it stuck, where is it stuck, how is it stuck, what's not moving, do I really need to move this joint? Because sometimes you'll have something that's stuck and causing a problem from the nervous system, and it's not exactly where the patient needs to be adjusted. I try to adjust one or two or maybe three different things in any given visit. The more you do, the less effective any one or all of those things are. So if I can figure out exactly what the one joint that needs to be adjusted is, I get a dramatic result in my patient. If I do two, you get 50-50, three, so on and so forth. So we're trying to be as specific as possible and fixing exactly what's wrong. The things that cause subluxations pretty much all happened to you before you were 7 or 8 years old. And there's no magic number there as far as it's 7 or 8, but it's around that time. Prior to that, your ligaments are loose, and they're loose on purpose so that you can grow quickly. Babies in the first year of life grow faster than at any other time in their lifetimes, and that growth rate increases dramatically all the way through age 7 or 8. And if your ligaments were tighter, like they are as a tween, 11 or 12-year-old, and then you have growth, and they have growth spurts, they have growing pains. In younger life, when the ligaments are loose, it doesn't hurt at all to grow. You just get bigger and bigger and bigger. And at a certain point, your body gets to be big enough and heavy enough and fast enough and strong enough so that when you do the things you do running around with your friends, you could really hurt yourself. And and that's when the ligaments start to tighten up and start to protect you as they do in later life. Ligaments' jobs in adults are to hold the joints together nice and tight so nothing bad happens. When you, let's say, twist your ankle in a hole, you're stretching or possibly even ripping some of those ligaments, and it hurts a lot. When that happens, you can use what's called RICE, R-I-C-E, rest, ice, compression, and elevation. But you can't do that with the spine when you have a sprain in the spine. Also, if you were to do something that would cause a subluxation, a new subluxation in your spine as an adult, it would be something devastatingly traumatic. Getting run over by a car and having joints ripped apart. Something horrible. And then in most cases, you wouldn't be coming into my office. There are quite a number of chiropractors here in Thailand who are not Western trained. They're trained in Taiwan, and the course is 6 months long, and they learn how to move bones, but they don't learn how to do anything else, and they certainly don't learn how to diagnose what's wrong with the body. That's okay if there's nothing actually really wrong with you. However, and it does not happen often, in 30 some odd years of practice, I had 2 patients come in with upper back pain who were having heart attacks and had nothing wrong with their spine in that area. And I checked them, so there's nothing wrong. There's no reason for me to adjust you, and I can't understand why you're having that pain. Let's take a look at your heart. Let's check your pulse. Let's listen to your heart and find out that those 2 people had really serious problems. One of whom took some time to get him to go to the hospital, and finally I ended up having to call his girlfriend to come in, and I said, screw HIPAA regulations. I don't care if I break the law. I'm getting her to come in. She came in, slapped him so hard across across his face, she knocked him off the table, and then brought him into the hospital. And they life flighted him from Brockton to Boston, which is 20 miles. They life flighted him. He had a quintuple bypass that day. The other guy gave me a hard time, and this was several years later, and I said, I'm not chancing that you're not going to do what I tell you to do. Get in my car. I'm taking you to the emergency room. And took him in. He had a quadruple bypass that day. Like I said, it doesn't happen often, but if one of those people were to show up at a Thai chiropractor's office, they'd die. I've had one patient with something called ascending paralysis. It's one of those things that they told us in school, oh, don't worry about it. Nobody's ever coming into your office with this. You just need to know it because you need to pass national boards. And this woman came in and was telling me this weird story that didn't make any sense at all, and it just clicked. And I asked her, I said, you know, did you have some sort of bacterial infection 2 weeks ago, 14 days ago? And she said, yeah, how would you know that? And I said, I can't explain to you right now, but we're calling an ambulance for you. And I don't want an ambulance, I want to go to the hospital. I said, no, I'm calling an ambulance for you. You need to be in the hospital because this is going to go on, and by the end of the day, you'll be dead. You're 28 years old. This is not okay. The ambulance is on the way. There are strange things that happen like that. It's not common, but there are strange things that need to be diagnosed, and so then you need to be at a doctor's office rather than at a practitioner's office. I don't know, I suppose I'll open it up to questions here, see if anybody has any information.
Thank you for your interesting talk.
Thank you.
I have seen many people helped by chiropractors in my life, but what always puzzled me or didn't know about is how osteoporosis affects the way you treat them.
The type of adjusting that I do is very, very short lever. I don't know if you remember basic science, probably in elementary school. The lever is one of those simple machines. So I contact the spine right on the spine, not broad-based with my hands. So I'm not really over the ribs. Ribs are really the only concern that you ever have with somebody who has osteoporosis, that if you put enough pressure on a rib, you could break it. But like I said, the type of adjusting I do is very, very short lever, and I'm not even contacting the ribs. So there's no concern whatsoever to what I do. The things that I see on YouTube and on Facebook scare me and are dangerous. And like one of the things, they wrap a towel around people's necks and give a yank. And keep in mind, that's one of the ways that they execute people. It's not the exact same type of contraption, but that can kill you. And I can't understand how any chiropractor could say, well, this sounds like a good idea, I'll do this to my patients. I just don't get it.
Is there any connection between the syndrome called myasthenia gravis and the use of chiropractic as a treatment?
Yes, actually I've had a number of patients with MG. Myasthenia gravis is an autoimmune problem, which means that your immune system is attacking you instead of helping you. And there are many different forms of autoimmune problems. I have one myself. In myasthenia gravis, the nervous system kind of just slows down. It makes you tired all the time. Sometimes your face droops. Sometimes you have uncontrolled tearing. It kind of looks in some ways like somebody who's had a stroke, but it's not a stroke. And with chiropractic, we can stick to working with the parasympathetic system way up at the top of the neck and way down at the bottom of the back. And it helps to slow things down and calm things down, because the one thing that really screws up MG is stress. So that if we can do things to help you decrease your stress, going for counseling, that's really important as well, to keep your emotional stress down as low as it can possibly be. And then the MG seems to be less of a problem, but it doesn't go away. There are no cures for any autoimmune problems. Did that answer your question? Okay. Yes.
Recently, since December, my husband has had 2 episodes of falling into such a deep sleep after a meal that he had to go to the emergency room. Everyone's just so mystified. And a couple hours later, he woke up normal. The doctors ordered everything for him, EKG, ECG.
Blood sugar?
And so I tried to investigate his symptoms on the internet, and I came up with postprandial somnolescence.
Yes.
But none of the doctors would, they just kind of shake their head and, nice little girl there. What do you think about that?
So the first thing you would think of is blood sugar, that the guy has diabetes and that blood sugar is skyrocketing and puts you to sleep. The next thing is this postprandial thing that you mentioned. It's a decrease in blood pressure because your digestive system is digesting your food. And it's not normal. Usually the cause of that is that you're taking high blood pressure medication and it's too strong and it needs to be reorganized.
Yes,
Right.
Thank you very much.
I am not a medical doctor, so I never tell anybody to take this particular medicine. I never tell anybody not to take this particular medicine. I give basic general information about what I think would be better and worse.
Thank
But
you.
I think I'd start there. Any other questions? One of the other things I wanted to mention is that chiropractic is really good at helping people to recover from strokes. It's not the care that you need immediately after a stroke, but after you've started to get better, sometimes people are having problems with speaking, sometimes people are having problems with moving or with balance. And one of the things that happens in a stroke, especially a stroke that's been caused by a bleed rather than a clot, is that all the blood vessels in the brain kind of clamp down and go into this holy crap mode. That's the best way to explain it. And they don't let loose, and they don't get back to their normal size and allow you to start to heal properly. And chiropractic can work with the nerves that control the size of the blood vessels inside your brain, so you can get them to relax. Probably the most dramatic case that I ever had was a woman who was unable to speak after her stroke. And I did a house call. I do house calls. I will do house calls here if I have to. It's not ideal because I don't have all of my equipment with me, but if the mountain doesn't come to you, then you go to the mountain. In any case, I went to her, and she was from Greece originally, and spoke fluent Greek, obviously, and also fluent English. After her stroke, she wasn't able to speak at all. We gave her one adjustment, and I think it took less than 5 seconds. She started speaking Greek fluently. She wasn't able to get back to English, but she was able to speak Greek, and from that point on, she called me her boyfriend, I think it was. I can't exactly translate the Greek, but it was a lot of fun to work with her. We never got her back to walking, but at least she was able to communicate with her family.